Hey, listen, guys, I want to say this to you. So I'm not being a jerk when I say this. My son, who's in medical school, frequently complains. People that I know who are getting their master's degree in nursing frequently complain it's so hard. There's so much material. There's so much work. Well, yeah, so that we don't kill patients. Okay? So you chose the wrong profession. This is too much. Seriously, it's not me being a jerk. It's not. When you guys get in the nursing program level 2, level 4, level 5, this will seem like it was a monastery or a convent and for chill. Okay? For real. All right, acute renal failure, ARF. What the hell is it? A sudden reduction in your kidneys doing their job. Okay? Now, there are a bunch of reasons why people get it. One could be old age. One could be there's a lot of other sicknesses going around, or something happened in the body that it brought about. So how do you monitor it? By serum, creatinine, and creatinine clearance. But they don't change unless you've got serious damage, okay? So what happens when you get acute renal failure? And guys, acute renal failure doesn't mean the patient's dying. They might die if things don't get better. Acute renal failure just means the kidneys stop doing what the kidneys are supposed to do suddenly. That's all that it means, okay? So what happens when that happens? Well, you get azotemia. And all that means is you're retaining nitrogenous wastes, okay? If things don't get better, the nitrogenous wastes go around the body, they continue to accumulate and do their disastrous stuff. That's called uremic syndrome. So, azotemia or uremia, you're starting to accumulate nitrogenous wastes. If it's starting to harm the body and you're not clearing them, that's uremic syndrome. Does that make sense to you guys? Okay.
And that comes out on the video.
Yes, that comes out of DUN, but only if it's really messed up. So we have pre-renal acute renal failure, intra-renal acute renal failure, post-renal acute renal failure. Causes outside of, inside, or after. Does that make sense to you guys? All right. So what causes pre-renal acute renal failure? Hypotension or hypovolemia. Anything that causes a reduction in either the vascular compartment or pressure in the vascular compartment. Profound dehydration, water loss, blood loss, cardiac failure, you name it. Shock. Does that make sense to you guys? Okay. And obviously, when you have acute renal failure, you're not doing the job, the last thing you want to do is pee, so you get oliguria. If you have too little fluid in the vasculature or not enough blood pressure, you don't do GFR rate high, right? Because you don't have enough to push through. Does that make sense to you guys? And you can have symptoms of what? Fluid overload. How is that possible? Because the fluid that's in there is causing either edema or ascites, right? It's shock. It's not getting cleared because we don't want to clear it, but it's not going to the right compartments. Does that make sense to you guys? All right. So there's a diagram that says what I just said. Okay? Here, if inflammation happens, or if you get tubular injury, bottom line, I want you to know this. This is overkill, but it's cool for clinical practice. Okay? Post-renal. What the hell does that mean? That means something is causing an obstruction outside. We filtered in the kidney, and now the filtrate gets out of the kidney, out of the renal pelvis, into the ureters, and somewhere from there to the urethra, it stops. It doesn't go anymore. Does that make sense to you guys? Well, what happens? Then it backs up, the fluid backs up, and you have glomerular problems. Does that make sense to you guys? Okay. Don't care about that. Intra. renal, acute renal failure. How do we get that? Any insult that happens in the nephrons. Like what? Giving a senior citizen a 40-year-old's dose of some nephrotoxic drug that's no problem for a 40-year-old kidney, but that is a problem for an 80-pound, 83-year-old man or woman. Does that make sense to you guys? And there's that. So listen, how does this present, acute renal failure, whether it's pre, intra, or post? It always presents in 3 stages. The first stage is the oliguric stage. I can't say that. And that's when suddenly you get acute tubular necrosis. What tubules? PCT, DCT. Okay? So, what are you doing there? You're not doing filtration. So, that can last up to a couple weeks. Now listen to me. Except for temporary circumstances like this, and there are a host of them, when you dialyze a patient, except for temporary circumstances, when you dialyze a patient temporarily, when you put somebody on dialysis, except for exigent circumstances like these, they're stuck on dialysis the rest of their life. Does that make sense to you? Okay. So here you might have to dialyze them. The second stage is the diuretic stage. They're starting to produce urine, and that's a good thing. But you still have azotemia because the tubules haven't gotten fully better yet. Does that make sense to you guys? And how long does that go for? It could go for up to a week and a half, okay? And then finally there's the recovery stage, and that's where you get your serum creatinine and your BUN. They come down to normal levels, and everybody's throwing a party. But it can take up to a year to have full healing, and many patients that get acute renal failure experience a little bit of renal insufficiency the rest of their lives, okay? And there it is, and good night. And I know who left, I don't need minute papers.